Scan gauge scans. How to correctly arrange scan gauges and perform scanning correctly with your intraoral scanner. Before starting, it is important to understand why the Nexus protocol requires a specific arrangement and 2 scans of a restoring arch. Intraoral scanners have inherent flaws when scanning edentulous arches, particularly over longer spans. Tissue is unstable. Therefore, the frames captured cannot be stitched together correctly by the iOS software, resulting in tolerance issues. Nexus mitigates these problems with 2 approaches. 1. Create consistent, stable surfaces across the edentulous arch by placing scan gauges effectively. 2. Scan twice. 1 from left to right and 1 from right to left. Then analyze to check the scanner's precision. Unlike other systems utilizing iOS for full arch, Nexus is the only one that can check the precision of scans even before design begins. Before scanning a case, understand the fundamentals of gauge arrangement. Proximity. Ensure gauges are placed as close to each other as possible without touching. Parallel positioning. It is best to arrange gauges with some side-by-side placement. This helps the scanner and ensures the scanner always has a gauge in its field of view. Height and angulation. Use gauges that are as close to the tissue as possible while still fully seated on the MUA. If severe angulation cannot be resolved by multi-unit selection or gauge choice, medium body impression material can be placed between the tissue and bottom of the gauge. This assists the scanner by providing a connection to the rest of the scan. Prior to scanning, prepare the environment and follow scan strategy. 1. Use retractors. Utilize retractor designs that hold back the tongue, cheek, and lips. Any interference during scanning will negatively impact accuracy. 2. Remove any moisture from the scan gauges. Saliva and blood may confuse the scanner and obscure the gauge facets. 3. Turn off any AI or scan assist feature on your intraoral scanner. 4. Scan in a single sweep. Do not scan over previously captured areas. 5. Begin at the furthest posterior gauge. Sweep across the arch, zigzagging to the opposite side. It is best to take it slow when learning the process. 6. Scan all 7 facets of the scan gauges. Any surrounding tissue is helpful, but not critical. To capture all facets, slowly and gently tilt the scanner side to side. With this in mind, scan left to right in the first scanning window. Move in one continuous motion, rocking scanner head as necessary to capture all gauges. Check that there has not been any interference and that all facets have been captured. If any artifacts or mistakes appear in the scan data, or if any of the facets of the scan gauges are missing, delete the scan and start again. Scan again from the opposite direction. Once complete, post-process and export from your iOS as STL or PLY files.